All right. Good morning, South Coast. Mike Silver, New Bedford Guide and Fall Reporter. We're here to continue our discussions we had in 2020 and 2021 into 2022, where we bring the medical professionals to you and can, bring some of the most important information directly from the doctors and medical professionals in the South Coast. With me today is Dr. Daniel Sacchetti. He is a DO at Southcoast Health. So welcome, Doctor.
Thanks for having me, Mike. I'm happy to be speaking with you this morning.
Yeah, just give me an intro of what your role is at South Coast Health and a little bit more about yourself.
Sure. So I joined Southcoast Health at the end of September of 2021. I work primarily at St. Luke's Hospital as a neurohospitalist. So that entails taking care of patients in the hospital who have neurologic issues and consulting with other providers to really ensure that they're getting the best care possible for any neurologic issues. The majority of patients I see have stroke or seizures or have some sort of alteration of their consciousness for some reason, but I also see a variety of other conditions. And then administratively, I work as the director, the stroke director for the system, and oversee care at Charlton, St. Luke's, and Toby Hospital for stroke care. So from everything from the second the patient hits the ED doors to the time that they leave and afterwards, I'm overseeing all of the systems of care in that regard.
Yeah, so you're the stroke director, and you just kind of detail what that it's about. But what kind of treatments do you perform? So obviously, strokes. There's a wide range of how many strokes there are, from minor to major. It hit home with me a little bit because my brother had some pretty major strokes many years ago, and it can take a long time to get back, and you may never get to full health. So, what are some of the treatments that you actually provide?
Of course, I'm sorry to hear about your brother. I hope he's doing okay. I think right now is an amazing time for stroke care. We have two main treatments for someone having an acute ischemic stroke. So maybe I should just back up and say that there's really three forms of stroke. The majority of strokes are what are called ischemic strokes, where a blood clot is blocking an artery in the brain, and there's lack of blood flow to the brain tissue. That makes up about 87% of strokes. The other 13% of strokes are hemorrhages, and either intracerebral hemorrhage, where there's a bleeding artery and a clot forming inside the brain tissue, or subarachnoid hemorrhage, which is commonly caused by an aneurysm rupture, and that's where you have bleeding onto the surface or around the sides of the brain. And so for ischemic stroke, we have two main treatments. One is IV TPA or alteplase. That's a thrombolytic agent. There's other thrombolytic agents as well. One agent in particular, tenecteplase, that's becoming more popular. But that is a medication that's given through an IV for someone with suspected ischemic stroke. It can be given up to 4.5 hours from the onset of the stroke symptoms. And there are risks and benefits to the medication, but it definitely helps patients in terms of their recovery when we measure 3 months out to see how people do. The other treatment is what's called endovascular therapy. And that's when someone has a major stroke and a major artery in either the neck or the brain is actually blocked by a big clot. We don't do that procedure at Southcoast, but we do manage patients like that in the emergency department all the time and work with our area hospitals, so-called comprehensive stroke centers, to work to get those patients to those facilities as fast as possible to try to get that clot out when it's appropriate.
Yeah, let's talk two different signs maybe. So there's kind of like maybe someone who's having a stroke, and then there's, of course, family and friends around someone who's having one. So, you see, I think there was a famous news anchor that, had slurred speech and droopy face. Like, what are some of the things someone who is having a stroke might see or feel?
Yeah, so it's very important that, patients and really everyone is aware of stroke symptoms. And, it's interesting, it can be a variety of different symptoms that someone could have. So you've already alluded to a few of them. So drooping on one side of the face, speech change, either slurred speech or someone who all of a sudden starts talking in a confused manner or has a halting type speech. Anyone with visual changes, so someone who has, really abrupt onset blurred vision or loss of vision. Someone has weakness on one side of the body, either an arm or a leg or both at the same time, numbness or tingling on one side of the body. All of a sudden, someone having problems walking, so gait dysfunction or imbalance, And sometimes dizziness, just if you're sitting there and just having like the world spinning around you, that can sometimes be indicative of a stroke as well. Those are probably the more common symptoms of a stroke. Certainly someone who has a mental status change, who, just starts out of the blue without any medication changes or any illness or any trauma, that would be highly concerning. Really the hallmark of stroke is how abrupt it happens. It really is like a light switch where you're fine one moment and then the next you're not. So that's really a hallmark of stroke.
And are there other ways to prevent stroke? I know, like, obviously healthy diet, maintaining your blood pressure. What are some of the ways that we can prevent maybe and have a healthier life without, maybe having a stroke in the future?
Yeah, of course. So, really you kind of already alluded to some of the main things, but blood pressure control is probably one of the most important things that someone can do to protect themselves from having a stroke. Certainly physical exercise and conversely physical inactivity, the more you can exercise and move your body, the better it is, not only for stroke, but for general health overall. Diet plays a big role. So, eating more vegetables and fruits and leaner proteins, and really staying away from lots of red meat is probably the best thing in fatty foods. It's no surprise there that's probably the best, diet for you. Smoking is a huge risk factor for stroke. And really nobody should be smoking or even using tobacco products at all. So that is a major way that someone can really reduce the risk of stroke. Other things like heart disease, people with certain cardiac arrhythmias can be at risk for stroke, specifically atrial fibrillation. And there's certain medications that people should be taking or considered if they have AFib. But then if you've had a stroke, there's certain medications you also should be taking as well. Things like antiplatelet agents, either an aspirin or Plavix or Brilinta or some combination thereof for maybe a short period of time. Most everyone should be on a statin medication that's had a stroke as well. These are all things that patients should talk with medical professionals about if they've had a stroke, and make sure that they're really on the right medications. But blood pressure control, stopping smoking, eating a healthy diet, and exercise are probably the most important things that you can do. If you have diabetes, obviously managing that and controlling it, those are the big things.
Is it all lifestyle, or does the genetics play a role at all?
Well, genetics certainly have a huge role, for a lot of different diseases, and there are certain, rare genetic conditions that can lead to strokes. But certainly, family history and genetics do play a role in this, and that's something we can't change as of right now. So you're kind of stuck with your family, whether you like it or not.
But the key is if you're genetically disposed to it, then lifestyle matters even more to you, probably.
Oh yeah, I mean, if I come from an Italian family that has some significant cardiac issues, and that's just the reality that maybe I need to do more in terms of my cardiovascular health than maybe someone who's got genes that are pristine. They live to, family members lived into their late 90s, early hundreds or something like that, and don't have any vascular disease. So certainly, knowing your family history and doing everything you can to compensate for any certain risks related to that is important.
Yeah, so I know there's not a one answer for all, but if someone has had a stroke out there, what does post-recovery look like, and what can they do to kind of benefit themselves?
Absolutely. So, after someone has had a stroke and they're in the hospital, there's pretty much a standard workup that's done. We do imaging of the brain, we do imaging of the blood vessels, we do typically an ultrasound of the heart, and we'll send off specific lab screening for, what your cholesterol profile looks like, and, if you have diabetes or not. And we try to make an assessment of why the stroke happened. There's very common reasons why a stroke can happen. There's a handful of very common disorders, but over 100 different diseases can lead to a stroke. So it's a very heterogeneous group of diseases that lead to stroke. So while you're in the hospital, we try to figure out the cause for the stroke. A lot of times we don't find a cause. In about 30 to maybe even 40% of cases, we do a thorough workup and we don't find an etiology. which is a huge area of research right now in stroke. But during the hospitalization, patients are assessed by therapy services, so physical therapy, occupational therapy, and speech language pathology. And there's a determination made of whether or not they'll need to go, a patient will need to go to a rehab facility after their hospitalization or can go back home. And in addition to that, what kind of therapies are indicated for their recovery. Stroke patients are vastly different. You kind of mentioned it earlier, where some people have mild symptoms, some people have major symptoms, and there's everything in between. And the recovery is highly variable patient to patient. It depends on where the brain is, where in the brain the stroke is, how much tissue has been damaged from the stroke, who the patient is, what their age is, what their comorbid status is, what their pre-morbid condition was, what were they like before. Someone who's elderly, who was in a frail state to begin with and using a walker, and then has a big stroke, is going to have a very, very different recovery trajectory than someone who's in their 40s and who has had a big stroke. And so really recovery occurs over the course of weeks to months, even out to a year and sometimes beyond. But the slope of the curve of recovery is highly variable patient to patient. And really the key is optimizing health, acutely. So making sure that we're doing everything we can to prevent complications of the stroke, like medical complications of the stroke, making sure we put people on the right medications to prevent a second stroke, and then giving them all the tools possible with the help of rehab services to make the best recovery possible.
Yeah, and information is power. Doctors can only do so much. What is a good resource for people to look for information, maybe for like prevention? Just get educated on strokes.
Sure. So I sent you a few links. It'd be great to share along with this video. But really, the American Heart Association and the American Stroke Association, that all falls under kind of one umbrella. That is a wealth of resources for patients and families. In addition, the state Department of Health has great resources on its website as well. There's some key resources for quitting smoking, which I would really encourage anyone who's smoking to quit and to use every resource possible to do so. And then, really there's a plethora of information in those links about, certain caregiver support lines, which that can be a very important part of stroke recovery for patients, is making sure that the caregivers have all the support they need as well, so they can be there for patients, as well as, certain kind of recommendations for, what blood pressure, goals you should have and what your diet should look like and all that sort of stuff.
Yeah, check the description in this video. Have a link there you can click and go to and get more information. Every person should, self-evaluate. If you have a history of, strokes in your family, you have maybe obesity right now, you have, problems with weight, those kind of things, you're smoking, check out the resource. And really, you have to be your own doctor in many ways and help prevent before a doctor needs to treat you in the future. So anything you want to close with, Doctor?
No, I really appreciate you inviting me onto your program. I'm happy to speak to the community. If at any time I can be a resource to anyone, please reach out to the hospital and get in touch with me. And I really look forward to taking care of patients in the greater New Bedford community.
All right, thanks. It was Dr. Daniel Sacchetti. He's the DO at Southcoast Health. He's the director of the stroke director at Southcoast Health. So thanks for joining.
Thanks so much.